Well, Dr. Jack Wolfson, always love our conversations and everything you bring to the world. And, I know I've heard you talk about this concept of the 100-year heart. And, heart disease, obviously, one of the number one killers, I believe it's the number one killer, in first world countries. And most people, their heart's not making it 100 years. And so is it designed to make it that long? And what's holding us back from that?
Yeah, I think it's definitely designed to make it to 100 and beyond. And when you think about the heart muscle and you think about the fact that it beats on average about 30 million times per year, and then if you extend that over the course of 100 years, well, of course, that now comes into like 3 billion heartbeats that somebody experiences over their lifetime. And it is designed for that. It is an amazing muscle that propels blood forward and circulates the blood and oxygen and all the nutrients around the body. And our creator designed us in that way for the 100+ years, and we see that in many centenarians that exist out there. There's no reason why we should not live until we're 100 years, save for some kind of traumatic experience or emergency. Chronic disease is the number one killer. Cardiovascular disease is, but again, that's all preventable. I believe we are genetically built perfectly, and when we give the body what it needs, take away what it doesn't, that's the 100-year heart strategy.
Yeah, for sure. And so what in conventional medicine, what are they doing? Like how are they treating cardiovascular issues? How are they looking at people when it comes to heart health?
Well, yeah, and the life expectancy in the United States is like late 70s for men, maybe 77, 78, depending on the year, maybe 80 years of age for women. And that's clearly not good enough.
Yeah.
It's not the way that it should be. And they're not only are they only lasting until that age in modern medicine, the modern medical world, but they're not thriving. They're just surviving. They're limping across that finish line. And you see that the last several years of life are often spent in and out of hospitals, certainly in and out of doctors' offices, and that's just not the way that it should be. The medical model, with their foundation of pharmaceuticals and surgeries, is a failure, and it was designed by people who only had their financial interests at best at heart. And that's when you look at things through that lens of how they're trying to push the pharma, how they brainwash the medical doctors into the pharmaceutical surgical model, you can just see the failures. But ultimately, 80 years is not good enough for me. My father died when he was 63 of a Parkinson's-like illness called progressive supranuclear palsy. And the Mayo Clinic had no idea why my father was sick and dying. And to tell my backstory is that I met a young woman who was a 29-year-old doctor of chiropractic, and she told me all the reasons why my father is sick and dying. And I listened, I changed, and now bring the message of natural heart health and longevity to the world.
Yeah. So, Kean, your father was a medical doctor as well, and a lot of medical doctors, unfortunately, are dying early. They should be the ones leading when it comes to health, right? They should be the ones living and having great lifespan and health span, right? And you were talking about that lifespan. Our lifespan is a certain amount, 78, 79 years or whatever, but the health span is typically like 55, right? After 55, people are typically on a lot of medications, surgeries, and that health span shrinking. And so it's definitely scary, but yeah, your father was conventionally trained medical doctor, so he should be leading the way when it comes to health, and unfortunately got sick at a young age.
Yeah, but he was just indoctrinated in the
Yeah.
mainstream medical model, which is of pharmaceuticals and surgeries. And I like to think about this, David, that when I was in my mother's womb, I'm listening to the conversations that are going on, and I was born into the medical matrix, into the medical paradigm, where I'm hearing again in utero my father talking about cardiology, and then I'm a baby and I'm hearing this. So it's like I was just indoctrinated it from day one. So I really understand all of those nuances and all of the methodologies of what they do. And of course, I would work in the biggest group in the state of Arizona as a hospital-based cardiologist for 10 years up until 2012. And I just saw all the failures in there. And to your point, the medical doctors, they buy into this whole thing too, and they don't last long either. So they take all the different pharmaceuticals, they take the statin drugs, they take the aspirin, take the blood pressure drugs, but at best, they are minimally effective. At worst, they kill people. And I think you can find arguments certainly on both sides. And I will tell you that ultimately, and tell your audience, because I know you know this as well as I do, that the pharmaceuticals are not the answer. God bless the men and women who work in emergency rooms and trauma centers, but for everything else, we got to go at things naturally. And I'm proud to, and thankful for you to, put out this message with me.
Yeah, and that's what you and your team do, natural and integrative cardiology. And what sort of lab testing? So if somebody comes in, they bring in labs, or if they want to run labs, what are some biomarkers that people can look at that really help them understand a little bit more about what's going on in their body, and in particular their cardiovascular health?
Well, our methodology at Natural Heart Doctor is eat well, live well, think well, and then all the different components that would stem from that. But where I think we help a lot of people is in the test, don't guess methodology, because a lot of people believe they're living this healthy lifestyle, and that's great, but we need to trust but verify. So let's verify what their numbers are. And I know you're a big proponent of this, and you've written books on this as it relates to inflammation. Measuring the markers of inflammation and oxidative stress are the ultimate guide to kind of where you are status wise. It certainly is not total cholesterol or lipid ratios. That really has little to do with what we are trying to accomplish. Now, if you see abnormalities there in the lipids, or if you see abnormalities in the inflammation markers, you need to find out why. Now, the lipids react to inflammation. They're part of the anti-inflammatory mechanism of the body, amongst all the wonderful, beautiful things that LDL and HDLs do for us. But we need to figure out the source of why there is all this inflammation. The medical community, as you know, David, that they understand that inflammation is bad. Now, their hammer to that particular nail is a statin drug. It's an aspirin. It's an antihypertensive. It's other, cholesterol-related drugs. They're even coming up with other injectable, technologies for this, for this purpose. But it's all about trying to figure out the why, because when you have the why and you can reverse the why, that's where it becomes very special. Now, real quick, when you look at people with high blood pressure, of which 47% of adult Americans are labeled with hypertension, what we find is that there are really 4 groups of people. So let me try and break this down real quick. So the healthiest people are people with normal blood pressure, no pharma. The most unhealthy people are people with high blood pressure, still with high blood pressure, on pharma. Those people die the quickest. Now, the next category is kind of tied, where we have people with untreated hypertension, basically equivalent to the people with normal blood pressure because of pharmaceuticals. So what I'm trying to say is that if your blood pressure is normal and you're on pharma, don't think you're at the same risk as Dr. Jack Wolfson and Dr. David Jockers, because you're not. They have falsely lowered a number, and it does not lead to significant benefit by any stretch. And that's looking at the benefit, let alone the side effects. So ultimately, if we're looking for longevity, pharma and longevity, it's an oxymoron. They do not exist together in the same sentence.
Yeah, so that's really interesting to hear. So basically, if somebody has high blood pressure, they want to figure out why is their blood pressure high and address the root cause. You talked about think well, move well, eat well. We're going to go back to that. But just taking a pharmaceutical to get the blood pressure normal, now the blood pressure is good. The cardiologist looks at it and says, okay, great. The drug is doing its job. Blood pressure is normal. Now he might think, he or she might think you're healthy, right? And that patient could walk out of the doctor's office thinking, okay, great, blood pressure is good, I'm healthy, but they never actually got to the root cause. And the research shows that they're still as at the same level of risk as when they had the blood pressure high without the medication.
There you go. And I think that's why, and not that I think, I mean, I know that's one of the reasons why I say that high blood pressure drugs kill millions of people. Statin drugs kill millions of people. Now, why would I say that? Where's the evidence of that? Well, the evidence of that is this fact. If we take someone who we put on statin drugs, for example, and according to their data, and we could talk about, is their data real or is it not, or could money influence the creation of data? I think everybody knows that is certainly a possibility. But let's just take it on face value. The goal is not to reduce your risk of having a heart attack over the next year from 2% to 1.8%. The goal is to reduce it to 0%. The goal is not to reduce your chances of dying of cardiovascular disease over the next year from 1.3% to 1.2%. But yet these are the numbers that exist. And why would I say that we're killing millions of people? Because millions of people are still part of that percentage on pharma who are still dying. And they die because they think, and really because they've been told, just take this pharmaceutical and you'll be fine. You can eat whatever you want, live however you want, think however you want. None of that stuff matters anything. Take the drug. And that's why I would say that over the course of the 40 years that statin drugs have been around as the #1 revenue generating class of drugs of all time, that it has been responsible for millions of deaths.
Yeah, and there's so many reported side effects with statin drugs on top of what you're talking about, where people just kind of get this false assurance and never really change their lifestyle. So let's talk about what people need to do to be healthy. Let's start with best foods for metabolic health, best foods for cardiovascular health.
Well, I think that in the concept of what kind of foods to eat and stuff like that, I do want to be clear about one thing, is that because we could argue about vegan, vegetarian, paleo, keto, carnivore, all these various things that people would argue about. But first of all, let's get the chemicals out of our food and make our food organic. So no matter what you do, right? So if you want to go vegan, just make sure it's vegan organic, and if you want to go keto, just make sure that all your stuff in there is super clean, and that's really is clean meats, clean poultry, clean eggs, clean seafood, clean produce, as well, plant, based type of things. Let's all agree on that. If you're like, hey, listen, I'm listening to Wolfson and Jockers right now, and I feel like having some ice cream. Hey, listen, I'm not going to promote it, but if you're going to go do it, just go get organic ice cream. If you're thinking about organic cookies or cupcakes or whatever. And I think you and I both, as parents of 4 children each, that really stems into the childhood as well. Just making sure that, hey, the kids are going to a birthday party. Okay, listen, go to the birthday party, have a good time, but we're not eating the Costco cake. We're bringing our own gluten-free muffins.
We've done that many times. Yep.
Yeah, I mean, it's just, I think the beautiful thing about that too is, yes, we're supporting our children, but we're also sending a message to the world like, hey, this is doable. Yeah. It's not easy in this world. There's a lot of things that can inhibit that, but this is the stuff that we need to do to protect our children and promote health and wellness to the world. So on top of the organic story, I do believe that seafood is the healthiest food on the planet. People with the highest levels of omega-3 from the consumption of seafood have the lowest risk of everything: heart attack, stroke, cancer, dementia, Parkinson's illnesses, and stuff like that. On top of that, and where do we go with that? Wild salmon, sardines, anchovies, clams, oyster, shrimp, lobster, crab. I think that's ancestral food. It's common sense, and again, makes perfect sense to me. Next, I would also say that nose to tail nutrition is critical as well. So my favorite animal for that sense is bison. We honor the bison. We honor everything that we eat. We pray over everything we eat, and we're thankful for everything that we eat. And that free range, grass fed, really just a wild bison that exists inside of miles of fencing, but nonetheless is wild and really untouched by man. That particular source of not only the meat, as we would think about steaks and ground and burgers, but also liver, heart, kidney, and the other organs. I think that organs are just some of this just perfect foods. So there we go with that. And then ultimately, we're also, we personally in the Wolfson household, we're gluten-free. I profess that to my patients as well. It's just not something that we need. Whether or not it affects you, we could debate all day long. We could test on that. And there's some phenomenal testing that we do on all of our patients, but There's really no need to eat gluten-containing grains, so we keep our grain intake to a minimum. Hunter-gatherer, that's the way to go from the nutrition side. And then again, certainly you're one of the worldwide experts as it relates to fasting, and fasting is a wonderful way to be healthy. We include that, of course, in the eat well conversation, I guess, of the times when you don't eat well because you don't eat, and all you're maybe doing is a water fast. And I do think, and you and I have discussed this before, and I've seen this in my patients, that once you get to that really extended duration of fast, once you get out to that 48 and certainly 72 hours, that's when we're starting to see plaque reversal, where the body is saying, I need nutrition, and I'm not getting it orally, and I don't have much fat stores to break down at this point. So therefore, I'm going to start breaking down scar tissue, and scar tissue in coronary arteries is plaque. And we have seen a lot of people reduce and reverse their coronary plaque and coronary calcification, although I do not recommend a CT scan, another conversation. But for those who did, we are seeing reversal, and I'm excited about that. And ultimately, it makes perfect sense when you look at it that way.
Yeah, that's amazing when the body goes into that mode, when insulin really, really drops, when you're fasting like that, your body needs that, needs protein, right? Because you gotta continue to build white blood cells, albumin, for pulling things around in the blood. I mean, you constantly need a renewed supply of protein. And if you're not consuming it, it's going to pull it from somewhere. And the innate intelligence understands that the plaque should only be there for a temporary period of time, right? And it's only patching up a wound, but it's not the ideal tissue. So that's the perfect tissue to use to build new, healthy, more stress resilient proteins. So it's going to start pulling it out. And it's amazing that you guys are seeing that with those kind of results. And so fasting can be really key. Obviously, we're talking a lot about that on my podcast and my summits. And so super key. What other lifestyle strategies? I know you talked about move well, think well. How does that play in here?
Yeah, and there's so much debate always, right, about the eat well part, but the live well and the think well are just as important. So looking at the concepts inside of live well, and really this is just common sense type things, which the medical doctors do not get trained in, the common sense methodologies. There are thousands of studies that show the benefits of sleep, and good sleep, and quality sleep, going to sleep shortly after the sun down and waking up before the sunrise, which is truly how we live. You and I are recording this, and as we speak, we go to bed typically around 8:30 at the latest, and naturally I wake up around 4:30 and I start my day, and I believe that's totally ancestral. We also talk about the importance of sunshine. So getting our solar panel, AKA our skin and our eyeballs, getting that out into the natural light. So as I record this with you right now, it's daytime. I'm sitting in the sun. In an outdoor area getting shade at this moment, but I embrace the power of the sun. Obviously, we know that it increases vitamin D. And interestingly enough, the way that we make vitamin D is the sunlight hits the skin, and cholesterol coursing through the skin's vessels is turned into vitamin D. Therefore, vitamin D goes up and total cholesterol goes down. But not only does the sun create the vitamin D, but it also creates nitric oxide, which is a vasodilator, and it's antiplatelet and improves circulation and flow. And one of the other amazing benefits, of course, of sun is that it helps to create melatonin. So when you get sun exposure during the day, melatonin is released at night when you go to sleep, and melatonin is the master hormone that controls everything else going on in the body. The master hormone is not thyroid, and it's not ACTH, and it's not testosterone, estrogen, progesterone. It's all predicated on healthy melatonin levels. So we want that. All right. So we talked about sleep, sun, movement, physical activity. The more we move, the more physical we are outdoors, the longer we're going to live. And then big category in the live well are the environmental toxins and pollutants. And first and foremost in that area, I spilled the beans on that one, is mold. Mold mycotoxins, bacterial toxins from water damage in your home. You may be sitting there thinking, my home doesn't have that. My home is brand new. I don't really care about what your opinion is on this, people. You need to get tested. Your life depends on it. The family's life depends on it. The dog and the pets and everybody's life depends on that home not having water damage leading to mold and bacterial exposure. Lots of new information coming out on this every single day. In addition to all the other things, the EMF and the pesticides and all these things that we talk about. And then to kind of wrap up the live well, everybody has to be under chiropractic care. The chiropractors are the neurologists. They are the real neurologists. They're the real neurology specialists, because not only do they diagnose neurologic related and brain related issues, but they actually have the ability to fix them. Neurologists in the MD version don't. They're just a bunch of pill pushers, and they recommend CTs and MRIs. But the chiropractors, not only are they phenomenal musculoskeletal, but they are the neurologists. So make sure everybody's under chiropractic care. And finally, holistic dentistry. Just really make sure that your teeth are in good shape, well taken care of. Again, hundreds and hundreds of studies that link dental sickness or oral health issues to cardiovascular disease. So very, very important to make sure you're taken care of there. And then, you wrap that up with think well.
Yeah, I mean, it's so key. So for a lot of people that are listening, hey, if you're following your nutrition strategies, you are exercising regularly, you're sleeping, you feel like you're sleeping well, you feel like you're following all these things, and you still have chronic symptoms, you're still not feeling good, you really have to investigate what's happening in your mouth, your oral health, what's happening with your spine and nervous system. That's where a chiropractor comes in. What's happening in your house, right? As far as household mold or other toxins you may be exposed to. You got to go through that series and, in a sense, address all of those areas. And then when you put all that together, you're going to have a plan for the 100-year heart.
Let me throw this out there, to you and to, whoever's listening as well. I thought of this recently as I heard someone make the statement, and we've all heard this before, where they say, my friend was healthy and then they died. My friend was healthy and then they had a stroke or had a heart attack. Here's the thing. If you are healthy, truly healthy through the lens of eat well, live well, think well, and you test, don't guess. If you are truly healthy in all those facets, you can't die. You can die of age-related, again, when you're 120 years of age, but you can't die of a heart attack. You can't die of a stroke. You can die of trauma, obviously.
But you're not going to be a 50-year-old man going for a 5K and all of a sudden drop dead of a heart attack. That's not going to happen if you're healthy.
Exactly. If you are truly healthy, that would. So whenever we think about someone who died of cardiovascular disease or cancer or some kind of autoimmune, or even stemming that into, suicidal behavior, of certainly, which I'm not going to profess to be an expert in that area, but a healthy person in the lens of eat well, live well, think well, doesn't have anxiety, stress, or suicidal ideations, and they don't. So the idea is that if you are truly healthy, you never get sick. Or let me say, it's not that you don't get sick. You're not going to die from any of these things. Now, a truly healthy person, certainly if you are exposed to some kind of environmental toxin, you may manifest the symptoms of your immune system kicking in, to heal. But let me also, stem into, think well. So I make sure that I hit this topic, is that the think well may be more important than all of these different issues that we talked about, the eat well and the live well. So the think well, as we look at the literature, we know that people who have anxiety, stress, depression have a much higher risk of cardiovascular disorders. We know that people with depression actually had a 10 times higher risk of being hospitalized for COVID over the last several years. So we need to really make sure that people find their happy place. And I think that happiness really stems from these areas inside of Think Well, where we focus on our spirituality. We focus on our purpose. What are we here for? I'm here to change the world of cardiovascular disease. You have all the different things that you're here for. We're also here to be, husbands and fathers, and again, wrapping that back into spirituality, what we're here for is, to serve, our Creator. But that passion and purpose, having that sense and having gratitude is huge, and self-acceptance. And then the sense of community. Social isolation is a massive, massive killer. People who identify themselves as socially isolated, they don't have a good community, friends, family, support systems. They die very young. They die much, much, much quicker. And then ultimately our sense of security, safety. Do we feel safe in our homes? Do we feel safe in our job, in our workspace? Do we feel safe in our relationships? Safe financially, as well. There's a lot of things that go into that. So we want people to really take a focus on that think well aspect. Certainly as a cardiologist, we never got any training in any of the things that I discuss right now, but certainly not in that think well space. But, there's a lot of different people out there who can help in this arena as well. But I just want to really identify that this is a problem and it needs to be taken care of to preserve your longevity.
Yeah, for sure. From a longevity perspective, just understanding you have a purpose. A lot of people, especially as they get older, they retire or whatever it is, and they lose that purpose. And I always say you got to have a why that makes you cry, right? So a purpose statement or a why that really inspires you to the point where you could get in tears, and then that's just going to drive you, and it's going to drive good behaviors in your life that help lead you towards a really healthy, long life.
Yeah, because not everyone is maybe going to have the purpose or the why to want to change the world, on a global level,
Yeah.
as my goals, would be, and yours as well. But maybe your why is, to be a spouse, to
Mm-hmm.
be a parent, to be a brother or sister, to be a friend, to be involved in charitable, causes, to again be a steward of religion and spirituality, to be a steward of the environment, and that really is available to anyone and
Yeah.
everyone of every single age.
Yeah, it's the best antidepressant ever studied is when you go out and serve somebody else, right? If you're depressed, if you're anxious, if you're feeling these kind of this sort of like troubled mood, right? Just going out, taking your mind off yourself and just going out and serving, helping other people is the greatest antidepressant. So really powerful stuff. Well, great.
Thank you.
Dr. Jack, I know obviously you've got your best-selling book, The Paleo Cardiologist, where people can learn more about this, and also naturalheartdoctor.com. What are they going to find when they go check out your website?
We're trying to, just identify to people that, hey, we are the worldwide leaders in cardiovascular health. Mayo Clinic, Cleveland Clinic are the worldwide leaders in cardiovascular disease. But, we know your cardiovascular condition, and we want to be able to help you with that particular condition. And that's what we do at Natural Heart Doctor. And it really just, I've seen so much pain and suffering from unnecessary pharmaceuticals, unnecessary surgeries, unnecessary sickness from people. And I've been on the wrong side of this equation. God bless the men and women who work in emergency rooms and trauma centers, but for everything else, mainstream medicine is not your answer, I promise you.
Yeah, absolutely. Total agreement. And thanks so much for your time, Dr. Jack. You're always a wealth of knowledge. Always enjoy our conversations. Guys, check them out, naturalheartdoctor.com. And we'll see you on a future interview. Be blessed, everybody.